The year is 2050. You open your eyes to a new day. Before you are fully awake, your virtual assistant is already greeting you.
Good morning, Lisa. You had 1 hour and 48 minutes of deep sleep last night? That's very good. That will keep you energetic and in a good mood today. Are you ready for a full body scanning?
You stand up in your room, ready for the body scan. The system scans you and compares today's data with not only your own health history, but also your family's, as well as the average from aggregated sources. The system predicts excellent health conditions for you for today and for the rest of the week too, but it suggests additional omega-3 intake from avocados.
The avocados will arrive with today's grocery delivery.
The virtual assistant tells you.
Don't forget your allergy pills. Pollen season is starting.
You smile and start to get ready for your exercise. As you run, your wearable device records your exercise routine and the biodata, also monitoring your health. After the run, the virtual assistant gently reminds you to hydrate. The suggested intake of water is at least 470 milliliters. In 2050, the question is no longer whether you should trust Dr. AI. Since personalized health analytics and diagnostic systems have become widely available, we now have visibility into our own health in a holistic way, with our own environments and family history considered. Personalized medicine has become a reality, so everyone has a Dr. AI who keeps us in excellent health. There will still be healthcare organizations, hospitals, and doctors. We just don't need to visit them very often anymore, since we hardly fall ill. Early symptoms of diseases are easily detected, and preventive methods and recommendations are made way before the real diseases happen. The human doctors are still very important, but they've become our health consultants. They can recommend the best personalized health analysis tools, answer any questions with a diagnosis, and provide further information or resources. Physicians in 2050 are free of any paperwork and have more time for one-on-one patient care. We still prefer the care provided by human healthcare workers in 2050, so we have the option to upgrade health insurance coverage to include time with human-to-human healthcare, aided by AI. How do we go from Healthcare 2021 to Healthcare 2050? Using AI in medicine and healthcare is not just the future, we need to start it now. By 2050, 1 in 4 people in Europe and North America will be over the age of 65. This means the healthcare systems will have to take care of more elderly patients with complex needs. Managing such patient needs is expensive and requires systems to shift from the current model to one that is much more proactive and focused on long-term care management. Some may ask, how will automation and AI affect the number of jobs in healthcare? The reality is, our healthcare sector faces a significant workforce gap, and we actually won't have enough healthcare workers for the demand. For example, the World Health Organization predicts a need for 18.2 million healthcare workers in Europe by 2030, so the current supply of 8.6 million across Europe will not either meet the demand for now or future. So, what do we need to do to provide personal Dr. AI and digital healthcare for everyone? First, we need to solve the data challenge. Today, the healthcare industry faces 2 different challenges when it comes to data. The first challenge is not having enough data, and the second challenge is having too much data. Let me explain. AI learns from data. For AI-powered diagnostics tool to work well for everyone, we need diverse data sets that would represent the diverse population in the world. But the reality today is, due to the lack of diverse data sets and the bias issues, current AI medical tools may only work well for certain populations. We need secure, trusted platforms and ways to collect data sets from the underrepresented, too. On the other hand, There's a staggering amount of health data already available, coming from medical journals, patient records, wearable devices, and many other sources, but 80% of this data is unstructured. As traditional technologies that can only process clean and structured data, we need to use machine learning algorithms to help us make sense of all the data. Second, co-innovation between the AI innovators and healthcare professionals. A recent research done by a team at MIT and Regensburg University suggested some doctors don't trust a second opinion when it comes from an AI system. They rated advice from the AI as low quality. This is a signal to the AI innovators that it's not enough to develop AI systems in isolation. We need to understand how humans use them. The best diagnostic algorithm in the world won't help if people don't trust its recommendations. Therefore, transparency and collaboration between innovators and practitioners will be key in scaling AI in healthcare. Third, a more robust AI governance in healthcare. Medical AI algorithms and applications are increasingly being proposed for the assessment and care of patients. But another recent report published in Nature shows most FDA-approved AI-powered medical devices have not been comprehensively studied to determine the fairness and accuracy of their algorithms. They have not been evaluated in multiple clinical sites to ensure algorithms perform well across representative populations either. The FDA did issue its first AI/ML action plan in January 2021 to outline plans in advancing the oversight of AI and machine learning-based medical applications. But this paper in Nature highlights better legislation and regulatory frameworks should be in place to protect patients while allowing AI's ongoing development. What other steps do we need to take in order for personalized healthcare powered by AI to become a reality? Leave me a comment and let me know.